Hi, my name is Sarah and I'm going to be doing my Cardiovascular and Pulmonary video for my BSN course for Health Assessment. And I'm going to use my patient today, and some sign-ups to keep in mind are that when you're listening to the lungs, you want to make sure that you're listening left side and right side in the same spot. That way you can very easily compare the two sides bilaterally instead of just doing all the left side and all the right side and trying to remember which sides may have had a crackle or something that was abnormal that you need to chart. Another note is that you always want to use your stethoscope directly on the skin, but for my video purposes today, I'm not able to do that, so my patient is I'm gonna listen to my patient through her shirt. So to start off, I am going to just observe my patient while they're breathing. I'm going to be looking at their shoulders and just their chest in general, looking to see if there's any bilateral movement that is not equal. Right now I do see equal bilateral movement with each breath. She breathes in, her shoulders go up bilaterally equally. Also, I'm looking at her abdomen muscles, seeing if she's having to use any accessory muscles to assist with her breathing. You can also assess your patient with some health history questions, asking them about family history, if they were a former smoker, if they are currently a smoker, if they've had any breathing issues in the past, if they're short of breath today, or if they've been in the past, if they do breathing treatment. You can ask them various issues that might come up. Just so from her appearance, I so far do not see any abnormalities. I'm going to go ahead and start palpating. And my first test is going to be the symmetric expansion test. So I'm going to use my thumbs and pinch just a little bit of skin up between the T9 and T10 area on her back and have her breathe in. And I'm going to be looking for my thumbs to move out with her breath equally on both sides, and making sure that there's not a delay in the movement. And I'll just have her breathe in a couple times to see if I can see any abnormalities. So I'm going to go ahead and breathe in. And one more time. It might be hard to see on the video, but my fingers were able to move out and then back in equally on both sides. So that is a good finding. Next, I'm going to be doing the tactile pharmacist. So I'm going to be using my ball of my hand and feeling various portions on her back and having her repeat the number 99. And I'm just going to be feeling for vibrations and seeing if they're equal on both sides. So I'll repeat 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. And her vibrations on both sides, if I was moving from left side to right side and right side to left side, they felt equal on both sides. I didn't notice any major differences that needed to be addressed. Next, I'm going to be palpating for any masses or tenderness. So I will just let my patient know that I'm going to be feeling around on your back, and let me know if you feel any pain or tenderness. And just be feeling around the outsides of the lungs. I'm going to go up the spine on both sides. Was there any pain or tenderness at any point? No. And I did not feel any masses, so that is a good fact, or a good finding. Now I'm going to do percussion on the posterior lung field. Once again, I'm going to be going side to side to feel for these, so I can compare the left and the right side. And so with that, you're just trying to detect any differences in sounds that you create with the percussion motion. And I did not notice any differences between the left and the right side. And next I'm going to be auscultating. So I'm going to be listening to all of her lung sounds on her posterior side right now. So I'll just have my patient take a deep breath in and out each time I move my stethoscope to a new spot on your back. Okay. Okay, and so for the most part, my patient's lung sounds were clear. I did notice some rubbing, but that's most likely just from the shirt that she's wearing. And in a hospital or clinical setting, you would want to have your stethoscope directly on your patient's skin so you don't get any of those incorrect readings. And now I'm going to be doing the Whispered ventriloquy and bronchoscopy test. With this, I'm going to be having my patient say the phrase 1, 2, 3 as I listen in various areas of her back. And with this, I'm hoping to be able to hear that she's saying something, but it'd be kind of mumbly. I don't want to be able to hear exactly what she's saying. If I can have a clear reading with what she's saying through my stethoscope where it sounds like she's whispering in my ear, that is an abnormal finding that I would want to report. And so with that test, I was able to hear like a mumbling that she was saying something like 3 distinct syllables, but I was not able to detect what the words were. So that is a good finding. Now I'm going to be doing the bigoscopy test. So I have my patient make an E sound every time I move my stethoscope, and I want to be able to hear that E sound while I'm listening. If I hear it sound more like an A, that is an abnormal finding that I would also want to report. Right. Now I was able to detect that my patient was making the E sound throughout each spot that I was able to listen to. Now I'm going to have my patient turn around, and I'm going to move on to the heart. So with the heart, there's 4 main valves that we're going to be wanting to listen to. The first one is the second intercostal space to the right of the sternum. That's going to be the aortic valve. And then on the other side of the sternum, on the second intercostal space on the left side, I'm going to be listening to the pulmonic valve. And then fourth intercostal space down on the left side, I'll be listening to the tricuspid valve. And then the fifth intercostal space on the left side, mid-clavicular line, I'll be listening to the mitral valve, where I'll be listening for the apical pulse for a full minute. I'll be determining if it is regular or irregular and the rate that it is beating. And you also want to let your patient know that you're going to be listening for a while, so just because I'm listening for a while does not mean that there's anything wrong. I'm just needing to do my full assessment. So I'm going to be starting on the right second intercostal space. And then I'll be listening for a full minute. Okay. And at the end of the minute, I can determine that her rate is a 72, which it falls between a 60 and 100, which is normal. And it was also a regular rhythm. I did not notice any skips or gallops within the heart rate. Now, for the last portion of this assessment, I'm going to be palpating the carotid artery. So I'm going to see on both sides. And I would rate her artery at a 2+. It is palpable. It's not thready, but it's not bounding either. It is normal, and it is equal bilaterally. Also, you want to make sure that when you are palpating the carotid artery that you're doing one at a time so you're not obstructing any flow of blood to the brain, which is very important. And then we're also going to auscultate the carotid artery. Okay, and then for auscultation on the carotid artery, you're just listening for any bruise, like gushing of blood, and you're also making sure that you're doing right sides and left sides and right sides, so you're able to compare both sides at each point that you're assessing. And for that artery, you are listening to 3 spots. You're doing at the base of the jaw, where the angle is, and then you're going to do about mid-neck, and then at the base of the neck on both sides. And that completes my cardiovascular and pulmonary assessment.